So my name is Amritraj Jabal. Everyone calls me Raj, and I am a specialist orthodontist. So being a dentist is something very interesting because it actually brings three things together. One is the scientific basis of teeth and all the bits about the human biology. The second thing is, of course, that wonderful world of physics that I can never get enough of. And the third one is actually, uh, I'm a people person. I love having chats. I love having chats and speaking to individuals and finding out how I'm going to make you guys happy. Orthodontics is one of those fields which is very, very diverse. You need to know everything about, multiple different topics. So you can consider things like, I need to know really well how to move teeth at a molecular level, and also and in a position where I can actually talk to patients about it. So I need to know a lot about aesthetics. I need to know a lot about biting and function. I also need to know the allied fields like sleeping and snoring and joints and all the other bits and pieces. It's one of those fields where I actually become the patient's friend over a longer period of time because I see them every month, and I try and make sure that that sort of uh, benefit is fostered between me and the patient. And it's always been like this in orthodontics, and it's one of those things which really makes it a very unique field. And of course, we need to know lots of other weird and wonderful allied components of orthodontics. Like I need to know photography and imaging. I need to know how metals work. I need to know how bone biology helps us in developing faces, etc. And we need to know the fundamentals of psychology of the patient, what their perception is of beauty. What is beauty? What is aesthetics? It's just too much, and I can't get enough. I think one of the most exciting parts of my job is that it's never really over. One of the worst ways of teaching orthodontics is that once you finish that phase of braces or aligners or any sort of treatment that you're trying to move teeth around, you think that one day it's done and that's the retainer and it's all done. But nothing's ever done. Nothing ever ends. It's always a little bit of a quiet uh, period of time where things just become a little bit more uh, out of your control. But you really do need to still be there watching. And that's where it really meshes into being an orthodontist for life. I think the most exciting part of my consultation is when the patients at the end say that that was amazing. They come out realizing so much more than what they actually thought a consultation would be about. You'd know so much more about what's going on in your mouth. And when they leave, they also feel that this was actually very honest. And so that consultation is just me being me and us divulging all that sort of information, which is you. The one thing I think is the most important aspect of orthodontics is the psychological component. It's a mind game. It's not moving teeth. Moving teeth is relatively easy and simple. The problem is that it takes a while. The other issue is that it's one of those things that we have to keep discussing with the patients. It's not the technical aspects of moving things around inside their mouth. It's more that reassurance and the chat, that confirmation, that certainty that you can try and bring in an uncertain world. That's the challenge. And that's what I love about my patients because they are up to it. And a lot of the patients come in not only with that robustness and ability to carry on treatments, which may take a little bit of time, but they'll also be there diligent, and they will be the most patient patients. I think the one thing that everyone needs to realize is, in the end, orthodontics is not just a one-off show. It's for life. And I'm your orthodontist for life.